He's gonna take Eric has been through the shit, man.
What's a water room?
If it's bad and it can happen to you, Eric's done it. He's just gonna give us a little pep talk about his journey, and he is a true survivor and a good buddy of mine, Eric Diamond.
My luck is so awesome.
LL Cool Town.
I don't play the dollar slots because I lose. Got 20 minutes? Hello? Yeah? Have to get closer. I'm gonna apologize ahead of time because my speech may be wonky and you'll kind of learn why. And I'm actually gonna read, which is cool, as you'll learn why, because a year ago I couldn't read. All right, I'm gonna give you my journey. If I open my eyes in the morning, it's a good day. This is a mindset that I've taken on throughout my life. I've had a hell of a journey, and I'll be sharing with you. Like many here, I have multiple headache types. I've had migraine since I was 5 years old. At 10, I developed daily tension headaches. These occurred every day for over 30 years. When I was 20, I developed episodic cluster headaches, my first occurring after a lovely experience with a girl in college. That was kind of fun. Scared the shit out of both of us. 10 years of misdiagnosis and being undiagnosed until I turned 31, and upon then, I went chronic. I'm almost 43. At 32, came idiopathic stabbing headaches, followed by a variant that the late great Fred Sheftel called thumpers. He didn't know what the hell to call it. Just felt like, just touch your head and tap yourself all day long. As far as headaches go, that's the gist, that's my story. When I was 34, I was diagnosed with APS, or antiphospholipid antibody syndrome. Since I only get random disorders, I was blessed with this one. Because it occurs mostly in women. Women will find out about it most of the time because with it is a high prevalence of miscarrying. Obviously, I'm not a woman, nor do I plan on becoming one. But I do, right?
Thank you.
Healthy men who have this will have a heart attack or a stroke. I was lucky. Mine was discovered when I had to have surgery for a bleeding ulcer. 37 was a fun year for me. I developed testicular cancer. My nickname, as many of you know from the old boards, is E-double. Since cancer, some called me E-single. And there's a select tribe amongst us who calls me Uno. I prefer you didn't. Quick shout out to Thunder, that's Joe, okay. And I said I'd say hello to Graham, Mr. Marblemouth, and hi Becky. Okay, they call me Uno, I prefer you didn't. At 41, I had a stroke. I don't recommend this one, you know? In a little bit, I'll be sharing some of the things that have helped me cope and live life regardless of the ailments. It's important to understand some of the shit that I've been through so that we can have a little self-reflection. The first 2 years of this current cycle for me, from 2004 through 2006, I was on the same laundry list of meds that the vast majority of you have been on. And I certainly couldn't function properly. I decided to detox because, in my opinion, the side effects of medicine were worse than the exquisite pain of cluster headache. I came off all meds, and although I dealt with pain, I now had my wits to function. I'm a licensed and board-certified behavior analyst. This essentially means that my expertise is in human behavior, why we do what we do, how it's learned, and how it can change to make socially significant improvement in people's lives. And as I'll discuss in a little bit, this has been a major this is aphasia, fun, stutter. And later I sound like I'm a drunk anyway, whether I'm drunk or not. So, this is a major factor in my functioning, as well as numerous peers with some of the same conditions that I have. There's no mind over matter when it comes to this pain, but our mindset can become positive, and many of us learn to function normally if we cope with the anxiety and the subsequent depression that can develop with chronic pain. January 2011, I started having pain in my satchel. I was assured that it was just inflammation and not cancer. Well, sure enough, it was cancer. I had testicular cancer, which metastasized to my lymph nodes. This was the only pain I've ever had that was close to a cluster headache. It dropped me to my knees into a fetal position. I would go through radical orchiectomy, which is the removal of writing. And I would go through radical orchiectomy, followed by 16 weeks of chemotherapy, which, by the way, you had asked about chemo, did absolutely nothing for my clusters. I was still getting hit in the chemo suite, which really sucked. I'll say, it was the first time in years that I had to use Imitrex, which I had sworn off. And I had just been up until then using oxygen, but I couldn't risk, I couldn't risk bacteria that sometimes build up in the tubing. No matter how well we clean it, stuff will get in that. And when you're going through chemotherapy, you have the risk of developing neutropenia, which I did, which is essentially your white counts drop so low that even the slightest touch of a sniffle can kill you. So 6 months prior to this, I had just opened up my dream. It was a diagnostic and treatment center for children with disabilities, developmental disabilities. And we were finally having our public grand opening with media and big names in my field. And then after running for 6 months, I went under the knife. I tried working, but each time developed neutropenia. It wound up driving us to bankruptcy, and we were losing everything. I decided to walk away from my business because starting a business, 18-hour days, and working out of state, away from my children, was difficult. After that, it took me about a year to recover. And in that time, I couldn't find steady work. It was difficult because despite I had an amazing reputation, despite my reputation, people were afraid that I would get sick again. So I fell back on an old teaching degree. Sorry. I fell back on an old teaching degree that I hadn't used in a decade. I was teaching in a classroom and finally bouncing back. I was trying to get our mortgage modified. You know, things were starting to look good. And I had dealt with this along with chronic cluster headache. And in 2013, I finally got to the point where I was given the okay to try alternatives. And I had always been non-responsive to meds. Every single thing I tried, nothing worked. They had no positive effect on CH. I tried the D3 and the seeds to no avail. And I finally tried mushrooms after a decade of following people's success. Thank you, Bob and the Cluster Busters. I went from having 6 to 8 attacks during a high cycle, and 2 to 3 possibly skipping a day or 2 during a low cycle, averaging 1 bad attack per month with some shadows throughout. And this has been consistent for the past couple years, until recently, where they've creeped out. They've creeped back, but I also haven't been able to maintain properly, so remember that one. Anyway, it's the first treatment that's worked. In 25 years of these things, the first thing that's worked. So, things were going on the upswing, and I was bouncing back from cancer. I was starting to make a few dollars again, and then I had a stroke while teaching on November 25th, 2014. It's been a really screwed up journey, and fighting foreclosure and being sick has honestly killed my marriage and taken so much from me. I try to remain positive. I fight and rehabilitate and live my life right. Now on disability, I'm being a full-time homemaker and a daddy, and I go to rehab. Physically, I'm about 85%, but I'm left with some speech issues, mainly aphasia, when I'm fatigued and overwhelmed. I stutter and I slur and I sound like a drunk. It sucks considering I used to lecture in front of several 100,000 people across the country. It also left me with some cognitive deficits, which prevent me from teaching or doing the clinical work that I've done for over 20 years. Some of you may be thinking, holy shit, how does he not drive off a bridge? So let's get back to some positive vibes. I keep smiling, and here's how. I'm beyond a functional chronic clusterhead for 13 and a half years, who's met and hugged hundreds of you guys. These days, I may not be as cushy with my words, as it's harder to get them out properly since the stroke in November 14. In 2004, I found clusterheadaches.com. Thank you, DJ. There, my life took a turn for the better. I had mentioned that I'm a behavior analyst. I've had extensive training as well in cognitive behavior therapy and rational emotive therapy. On the boards, there's a gem of a man, Mr. Bob Johnson, who's also a clinician and a therapist. And we've had many discussions regarding anxiety and depression. About a decade ago, I presented at Ouch Richmond Convention on the use of behavior analytic principles to decrease anxiety and understanding the mechanism behind it. He wrote an essay that has become influential in my daily life and the foundation of what I share and how I support other clusterheads. And I hope it inspires and clarifies what it is to take your life back if you haven't or if you feel that you can't. I'd like to give an excerpt from it. Pain versus suffering. At the heart of this is the recognition that pain and suffering are rather different experiences, which can and must be changed by rather different responses. The pain of our CH is the subject of many of the messages we exchange. The topic fills medical literature we read and is the primary purpose for multiple visits to doctors. Suffering is quite a different animal. It is an emotional, psychological condition which is often experienced when there is no pain. It's commonly experienced as fear, anxiety, depression, hopelessness, dread, and that fearful anticipation. Suffering is a normal, even automatic response to pain, loss, as in death, or divorce, or other major losses. And it's a host of other difficult experiences. However, suffering can be intensified, sustained, and even create quite independently of any of these experiences. In the case of our CH, suffering is too often experienced when we are not having attacks. The hard paradox is, we can suffer even when we are not in pain. This is the paradox which we need to resolve if CH is not to be the controlling experience in our life. As we read messages about clusters in the groups, they fall into two broad categories: causes, prevention and treatment, and subjective experience, or the emotional side of clusters. A sample of the experience messages, which we see are along the lines of: 1, CH is horrible. It never stops. Or will it never end? Or they will go on all my life? Things like that. 2, I can't bear the pain. Nothing makes me feel better. Or medication, nothing works. All have failed. On and on. 3, it's not fair. or something along those lines. Why is God doing this to me? Am I being punished? I feel so guilty because of how I burden my family, or I can't work, etc. 4, the worst thing in my life, or some variation on how clusters is a catastrophe. I can't handle it. So before moving on, the concept behind cognitive or rational emotive therapy, you're going to recognize. These therapies are rooted in the basic idea that how we think about an experience creates corresponding emotional reactions, for good or bad. The research on the effectiveness of this approach is very good. Outcome research shows that it's an effective form of therapy for depression, anxiety, and addictions of various types. Cognitive therapies teach people to recognize the following. A, these thoughts may be spontaneous and automatic, but B, they're not rational thoughts, and so, in the very lack of reason, they stimulate emotion, which are disruptive, distorting, and which intensify the difficult experience of clusters.
That's right.
Now think about it. You ever have that, you're peaking during an attack, and you feel so anxious. Those of us who you can't, you know? And then you wind up getting sick, okay? A lot of times people talk about, for example, nausea is many times associated with migraine, but not really associated with clusters. And we hear people who get sick during it. From what I've learned over the past dozen years on these boards, they're getting sick, not when it's coming on, but at that very, very peak. And it may be a part that you're so at the height of pain, but it's also a matter of you're so riddled with anxiety. You learn to calm that down, some of those things don't take place. My apologies. That's what bad when I lost my place. Hi, y'all.
Love you, brother.
Okay, all right. So these ones. All right, the bottom line. The style of non-rational thinking and associated emotions tend to spill out or generalize into larger lies affecting relationships, beliefs, and how effective we are and how we're able to run our lives. If, and this is often difficult for people to accept, we can begin to see how our thinking may not be fully rational, how these ways of thinking feed our suffering, then it may be possible to change our thinking habits. The next step, past a willingness to consider that we may be thinking this way, is how to learn how to dispute with ourselves. That is, how to argue with our thinking is not reasonable, that is self-harming. Then we learn how to change thinking habits with the goal in mind that by changing how I think about my experience will change how I feel, how my emotions affect me. So let's go back to the sampling of expressions which we in our message boards and clusters see how cognitive psychology would deal with them. Go back to number 1. CH is horrible, it never stops. So first recognize the despair and hopelessness which arises from this statement. Where will this line of thinking take me? So we learn to respond more rationally. Yes, it's hard pain, it's awful, but it's always stopped. Even when I don't treat it, it's going to stop. I can survive this attack, as I have every single one. I need to do what I know helps. The long-term effect of this change in thinking is to increase self-confidence and a sense of capacity to benefit ourselves. 2, I can't bear this pain. Now our response will be, I always have. I know pretty much what to expect. I've got some medications, which might help. I can bear the pain because I always have. Notice this isn't denial of pain. It's not, let's pretend. The goal is to deal with the reality of temporary pain. Pain which, as bad as it is, has always stopped with our return to reasonable well-being. We're fine after. Sucks, but we're fine. It is the denial of this, our personal experience, which arouses suffering and despair. It's not fair, or thoughts of guilt, or that I'm being punished. In our response, this is my body not working right. It has nothing to do with morality or sin or fairness. My job is to care for me, now, and not fret about fairness. The consequence of appeal to fairness is that we become victims. The problem with guilt is that we have to find a sin, which justifies cluster headaches, or we must convince ourselves that we have chosen CH to avoid something, or to hurt someone, hence our sin. In the end, this line of thinking is not reasonable or rational and serves to create more suffering. CH is the worst thing in my life. I often see folks express this in their messages in a sense of anticipation, a feared expectation about the next attack or cycle. There are few responses which lend themselves to the development of suffering better than this one. Waiting for pain, looking for the next sign, assuming that it'll come. Let's reflect on the moment on what the impact is on our emotional well-being, and you may begin to appreciate why changing thinking habits is of value. How to respond. It is the worst experience when it's occurring. Then it's over, and I'll return to my full life. My whole experience says that I'll come through the next one when and if it comes. I don't have to wait and look for it. There is living to be done now. Many of us say, live between the hits.
Yep.
Go with it. All right. I've used this to help me with clusters and other headache types. I've used this to help me get through cancer. I've used this to help me deal with a stroke, which has been my hardest battle to date. I've managed through college, grad school, postgraduate work. I've taught, lectured, married, had kids, consulted, had my own clinic, beat cancer, and was teaching, all with chronic disease. This is in no way to pat myself on the back. Hopefully this will give a little inspiration. I went from a functional chronic to a managed chronic, practically eliminating all headache types by using psilocybin. That being said, it was my mindset that's helped me survive it all.
That's right.
Thank you.